So this is a typical surgical suite, and we have about actually 20 surgical suites that we've grown into, and we're continuing to grow into. We work out of 3 office buildings, but this was my home office with about 8 operative suites, and each suite is set up in a similar fashion with various comforts and some unique things that I like to discuss, simply because some of these things we created and pioneered, which have become very helpful to me in my daily practice. One of them, which is not very well known or publicized, is what's called an operating microscope, a zoom stereo microscope, that allows me to actually perform surgical procedures on very delicate areas, particularly eyelids and areas very close to the nostril or very close to the vermilion portion of the lip. It's nice to have perfect visualization, and so this is a so-called a zoom stereo microscope, because we can change the focus of it anywhere from 3x to up to 18x and zoom in on the very specific area, and then be able to operate within a certain working distance between the patient and the scope head. So basically, if the patient's head is here and I'm looking through the scope, and I can see exactly what I'm doing. So basically, a very visual field. Dermatology, like none other in medicine, is extremely reliant on very good visualization. And so the technologies that have become available are quite helpful, and the main one that I focus on often is this handheld dermatoscope, which is basically an LED light with special optics that allow us to see, as we look physically into the skin, various surface structures that have color and shape, and it's a whole new language. It's like comparing what you see when you're snorkeling at the bottom versus when you scuba dive and you go down and you really start to see deeply into the layers of the skin. So I would compare the naked eye view of a patient to kind of looking from a distance as though you're snorkeling on top of the water, versus the dermatoscopic view, which is a 10x microscopy that allows us to see so many more things that you can't possibly see with your naked eye. I liken it to scuba diving, where you're actually looking at the coral and seeing the colors and the shapes and all the movements, and so we can actually see blood vessels and every little detail. And this tool has come a long ways. Actually, it was the Europeans and Australians that are pioneering this, and there's a vast body of literature now. And so if your dermatologist hasn't gotten on board because they're too busy or they were never trained to use dermoscopy, I think that I'm a little bit biased, and I would recommend skin cancer screening if you're high risk with a physician that is well equipped and also well trained to use a dermatoscope to find skin cancers in the earliest form of development, and also to help you delineate and outline the actual cancer that's present. So before I even begin to cut a patient, oftentimes we'll look through our scope and look at the surrounding skin, because it's not unusual that we'll find the second little basal cell cancer that is so close by the first one. Instead of doing them separately, we'll go ahead and take care of them all in one sitting, and that's also an advantage. But this contraption, this microscope, was designed, this whole setup, by a cabinet man and myself, and with a special fiber optic light that allows us to see very carefully and be more precise with our excisions when we're performing surgery on very delicate areas.
you.